Good evening. Today we'll be discussing regarding KRYSTAL-12. It's a phase 3 trial of Adagrasib versus Docetaxel in previously treated KRASG12C mutated NSCLC. So we know that Adagrasib received accelerated approval in US and conditional approval in UK and Europe for locally advanced and metastatic NSCLC with KRAS G12C mutation. So the approval were based on phase 2 KRYSTAL trial that found a deep durable responses with promising PFS and OS were seen in previously treated advanced KRAS mutated NSCLC. So Adagrasib is currently the NCCN category 2A recommendation for advanced KRAS G12C mutated NSCLC with brain mets. So this was the trial in which ECOG PS 0 and 1 who were previously treated immunotherapy or platinum-based chemotherapy were received, and they were randomized into two arms. One is Adagrasib 600 mg twice daily, another arm was Docetaxel 75 mg per meter square every 3 weekly. So the primary endpoint was PFS by BICR and overall response rate by BICR was the secondary endpoint. So the median characteristics were well matched in both the arms. When we see that more than 65 years of age, that were also nearly 50%. ECOG 0 and 1, they are more or less, ECOG 1 patient were more. The metastatic patients were 94-95%, only 5 to 6% patients were locally advanced. Adenocarcinoma was a predominant histopathology. Based on the brain mets, nearly 70 to 18% patients had baseline brain mets. So the PFS was in Adagrasib was 5.5 versus 3.8 in the Docetaxel with a hazards ratio of 0.58, and 6 months PFS was 45 versus 30. So when we talk about the PFS in all the subgroups, Asian population, gender-wise, smokers, non-smokers, we can see that the Adagrasib was better than the Docetaxel. When we talk about the duration of response, it was 8.3 versus 5.4 months in Adagrasib versus the Docetaxel. When we talk about the intracranial response by blinded independent central review, we can see that intracranial overall response rate was much better for Adagrasib versus Docetaxel, 24 versus 11. So we did talk about safety. Usually it was well tolerated. I mean the grade 3 adverse events were nearly 47 in Adagrasib and 46 in the Docetaxel. The predominant side effects were diarrhea, vomiting, nausea, and raised transaminitis, which were commonly seen in this arm. So the conclusion is that the KRYSTAL-12 trial demonstrated longer PFS with Adagrasib than with Docetaxel in patients with previously treated KRAS G12C mutated NSCLC. The number is 5.5 versus 3.8 months with a hazards ratio of 0.58. Overall response rates were significantly higher with Adagrasib than with Docetaxel, 32 versus 9%, and it was active in patients with CNS mets at baseline. Intracranial overall response rate was 27% with Adagrasib and 11% with Docetaxel, and investigators conclude that Adagrasib is an effective treatment option for patients with NSCLC and KRAS G12C mutation who have progressed on chemotherapy and immunotherapy. Thank you so much.